In this topic, salivary gland tumors are classified into benign and malignant types. We will also discuss the histopathological features of pleomorphic adenoma and Warthin tumor, and differentiate the major malignant salivary gland tumors. According to Robbins, most salivary gland tumors occur in the parotid gland, and most of these are benign. However, tumors arising in minor salivary glands have a higher probability of being malignant. Salivary gland tumors are broadly divided into benign and malignant categories. Pleomorphic adenoma is the most common benign tumor, while mucoepidermoid carcinoma is the most common malignant tumor overall. Pleomorphic adenoma is the most common salivary gland tumor and is also called a benign mixed tumor due to its mixed epithelial and stromal components. Histologically, pleomorphic adenoma shows a mixture of epithelial and myoepithelial cells forming ducts and sheets. The stroma is highly variable and may appear myxoid, cartilaginous, or fibrous, which is a key diagnostic feature. Warthin tumor is strongly associated with smoking and typically affects older males. It is unique among salivary tumors due to its lymphoid-rich stroma. The hallmark of Warthin tumor is its cystic and papillary architecture lined by oncocytic epithelium, resting on a lymphoid-rich stroma that often contains germinal centers, making it distinctive. In this comparison chart summarizes the two most important benign salivary gland tumors, pleomorphic adenoma and Warthin tumor. Although both commonly arise in the parotid gland, they differ significantly in their histopathological features, clinical associations. Mucoepidermoid carcinoma consists of mucus-producing and squamoid cells. The proportion of these cells determines tumor grade, which strongly influences prognosis. Adenoid cystic carcinoma is characterized by its tendency for perineural invasion, which leads to pain and recurrence. Histologically, it shows cribriform spaces filled with hyaline material. This rapid revision summary chart compares the major malignant salivary gland tumors based on their histopathological features, behavior, and clinical importance according to Robbins and Kumar. Starting with mucoepidermoid carcinoma, this is the most common malignant salivary gland tumor. It is composed of a mixture of mucus cells, epidermoid or squamous cells, and intermediate cells. Histologically, the tumor contains both cystic and solid areas. Low-grade tumors contain more mucus cells and cystic spaces, while high-grade tumors are more solid and aggressive. Prognosis depends largely on tumor grade. Next is adenoid cystic carcinoma, which is a slow-growing but highly aggressive malignant tumor. The characteristic microscopic appearance is the cribriform or Swiss cheese pattern formed by basaloid epithelial cells surrounding spaces filled with hyaline material. One of its most important features is perineural invasion, meaning the tumor spreads along nerves. This explains why patients often experience pain and why the tumor has frequent recurrence despite slow growth. Acinic cell carcinoma shows differentiation toward serous acinar cells of the salivary gland. Microscopically, the tumor cells have granular basophilic cytoplasm due to the presence of zymogen granules. It commonly occurs in the parotid gland and usually behaves as a low-grade malignancy with relatively favorable prognosis compared to other malignant salivary gland tumors. Carcinoma x pleomorphic adenoma arises from a pre-existing pleomorphic adenoma. Histologically, areas of benign pleomorphic adenoma are seen alongside malignant epithelial components. Clinically, a patient usually presents with sudden rapid enlargement of a long-standing salivary gland mass, which suggests malignant transformation. Lastly, salivary duct carcinoma is a highly aggressive tumor that resembles ductal carcinoma of the breast on histology. It shows solid and cribriform growth patterns with marked cellular atypia and sometimes comedo-necrosis. This tumor has a poor prognosis because it commonly spreads to lymph nodes and distant organs. Overall, differentiation of malignant salivary gland tumors is based mainly on characteristic microscopic patterns, cell types, and biological behavior, all of which are essential for diagnosis, treatment planning, and prognosis. Question number 1. The most common benign salivary gland tumor is A. Warthin tumor, B. Pleomorphic adenoma, C. Mucoepidermoid carcinoma, D. Acinic cell carcinoma. The correct answer is B. Pleomorphic adenoma. Pleomorphic adenoma is the most common salivary gland neoplasm and the most common benign salivary gland tumor. It is composed of epithelial and myoepithelial cells embedded within a variable myxoid or chondroid stroma. Question number 2. Warthin tumor is strongly associated with A. Radiation exposure, B. Smoking, C. Alcohol use, D. Viral infection. The correct answer is B. Smoking. Warthin tumor has a strong association with cigarette smoking and commonly occurs in older males. It is the second most common benign salivary gland tumor and usually arises in the parotid gland. Question number 3. Which salivary gland tumor contains both epithelial and myoepithelial cells? A. Warthin tumor, B. Pleomorphic adenoma, C. Adenoid cystic carcinoma, D. Mucoepidermoid carcinoma. The correct answer is B. Pleomorphic adenoma. Pleomorphic adenoma is a biphasic tumor composed of epithelial and myoepithelial cells. These cells are arranged in ducts, sheets, and cords within a myxoid, chondroid, or fibrous stroma. Question number 4. The characteristic microscopic feature of Warthin tumor is A. Cribriform pattern, B. Chondroid stroma, C. Double-layered oncocytic epithelium with lymphoid stroma, D. Keratin pearls. The correct answer is C. Double-layered oncocytic epithelium with lymphoid stroma. Histologically, Warthin tumor shows cystic spaces lined by a double layer of oncocytic epithelial cells. Beneath the epithelium is a dense lymphoid stroma containing germinal centers. Question number 5. Which malignant salivary gland tumor is the most common? A. Adenoid cystic carcinoma, B. Salivary duct carcinoma, C. Mucoepidermoid carcinoma, D. Acinic cell carcinoma. The correct answer is C. Mucoepidermoid carcinoma. Mucoepidermoid carcinoma is the most common malignant salivary gland tumor. It contains varying proportions of mucous cells, epidermoid cells, and intermediate cells. Question number 6. A 62-year-old smoker presents with a painless swelling in the parotid gland. Histological examination reveals cystic spaces lined by oncocytic epithelium and a dense lymphoid stroma. What is the most likely diagnosis? A. Pleomorphic adenoma, B. Mucoepidermoid carcinoma, C. Warthin tumor, D. Acinic cell carcinoma. The correct answer is C. Warthin tumor. The combination of smoking history, parotid gland involvement, oncocytic epithelial lining, and abundant lymphoid stroma is highly characteristic of Warthin tumor. Question number 7. A salivary gland tumor demonstrates a cribriform or Swiss cheese appearance on microscopic examination. What is the diagnosis? A. Pleomorphic adenoma, B. Adenoid cystic carcinoma, C. Warthin tumor, D. Acinic cell carcinoma. The correct answer is B. Adenoid cystic carcinoma. Adenoid cystic carcinoma classically shows a cribriform pattern and is well known for its tendency to invade nerves. Question number 8. A patient presents with a painful salivary gland mass. Histology demonstrates extensive perineural invasion. Which tumor is most likely responsible? A. Warthin tumor, B. Pleomorphic adenoma, C. Adenoid cystic carcinoma, D. Acinic cell carcinoma. The correct answer is C.
Adenoid cystic carcinoma. Perineural invasion is the hallmark feature of adenoid cystic carcinoma and is responsible for the pain experienced by many patients. Question number 9. Recurrence of pleomorphic adenoma after surgery is mainly due to A. Hematogenous spread. B. Perineural invasion. C. Pseudopodial extensions beyond the capsule. D. Multifocal origin. The correct answer is C. Pseudopodial extensions beyond the capsule. Although pleomorphic adenoma appears encapsulated, microscopic extensions can project beyond the capsule. If these are left behind during surgery, recurrence may occur. Question number 10. A 58-year-old patient has had a parotid swelling for many years. Recently, the mass has enlarged rapidly. Histology shows areas of pleomorphic adenoma together with invasive carcinoma. What is the most likely diagnosis? A. Mucoepidermoid carcinoma. B. Acinic cell carcinoma. C. Carcinoma x pleomorphic adenoma. D. Warthin tumor. The correct answer is C. Carcinoma x pleomorphic adenoma. A sudden increase in size of a long-standing pleomorphic adenoma suggests malignant transformation. Histologically, both benign pleomorphic adenoma and malignant epithelial components are identified.